Hello, my name's Ollie Morris. I'm a GP working in Southampton.
My name's Sally Hinder and I'm a health visitor in Farnborough.
And in this video, we're going to be talking about earache or middle ear infections in children. So you're probably looking at this video because you've got a child you think's got a problem with their ear, and that's either because they've told you that their ear's hurting, or if it's a younger child, they might just simply be holding their ear more than normal, or rubbing it, or pulling it. And often they've got some other symptoms with that as well. So they might have a bit of a runny nose, a bit of a cough, sort of virally type symptoms, and they often will have a fever, at least for the first few days. And what we're going to talk about here is why you get ear infections, what sort of things you can expect when your child has an ear infection, and towards the end we'll also think about when you might need to get some extra help and support for your child.
So middle ear infections are more common in younger children, particularly preschool age. Half of children will have had 3 episodes of ear infection by the time they're 3, so it's not uncommon at all. And for some it may be more than that as well. They are slightly more common in boys than girls, and also if you're mixing with other children, so if they are going to a nursery or if there's older siblings that might be going to school or nurseries and bringing viruses back. Tobacco smoke exposure is also a risk factor for ear infections, but they are less likely to happen if you breastfeed your child. Most children with a middle ear infection will get better by themselves in around 3 days. Around 1 in 10 children, this might take up to a week for them to recover, but most it will be shorter than that. The first day or 2, the pain can be quite bad, so giving something like paracetamol and ibuprofen should help to manage that pain and discomfort. Decongestants and antihistamines, so things that you would normally use for sinus relief and things that you would normally use for allergy relief, don't help in these circumstances. They don't help the symptoms, they don't help the cause for it. Some people may be thinking that they might need to get some antibiotics for their child's ear infection. It is very, very unlikely that they will help your child. Most children, their ear infections will get better without any antibiotics, and even when antibiotics are given, it's unlikely that it will make much of a difference in terms of amount of time that it takes them to recover from an ear infection. And they can cause, if you're giving antibiotics or a child has antibiotics unnecessarily, then it can cause other things like diarrhea and vomiting and antibiotic resistance as well. So generally not necessary. Serious complications of ear infections are very rare, and this isn't impacted by whether your child takes antibiotics, so the rare complications will happen whether they have antibiotics or not, so that shouldn't be a factor in seeking antibiotics for that. However, there might be some instances in those cases where there might be some more serious complications where you might need some extra help. So Ollie, could you let us know what those might be?
So you might want to discuss your child with a healthcare professional, get them checked out for a couple of reasons. So one might be that they might be a child that actually would benefit from antibiotics, and we'll talk about features there that sometimes indicate antibiotics can be helpful. And the other might be concern that actually the child is a lot more seriously unwell than a straightforward middle ear infection. And the features there can either be particular ones or particular complications of ear infections, or more general signs that your child's body is just struggling to cope with the illness. So if we start with the general signs, they are the regular sort of serious or concerning features that you will find pretty much looking at any of the red amber features for children with illnesses. So they're quite general features that show that your child's body is struggling either with its breathing system or with the circulation system or with a level of consciousness. So they're usually quite concerning things. So if you look at the red features of the fever pathway or the earache pathway, they're quite similar. Obvious things like if they have a seizure or a fit, if they have that rash that when you press on it with a tumbler doesn't go away, so the non-blanching rash, if they are really almost impossible to wake up and rouse and keep awake, They're all quite concerning things you'd go straight to the emergency department or call 999 for. The more general things that are what we call amber features, so you might want to discuss with a healthcare professional, are maybe not as severe as that, but things that need to be checked out. So that's things like a child who's between the age of 3 months and 6 months with a temperature above 39 degrees centigrade. Or it could be children that are breathing a bit more effortlessly than normal, not so much that you're worried they need to go straight to hospital, but you're just concerned that they're struggling a bit harder with their breathing. Or you're worried you're not really keeping on top of fluids for your child. So they maybe haven't been to have a pee for more than 12 hours and they're looking a bit dry and they're just not keeping down fluids. So it's those sorts of things. So those are the general sort of red and amber features. For earache, there are a couple of other amber features that are particular to having a middle ear infection. And they're really signs that the infection either might have be the kind of infection that antibiotics could help with, or that it might have spread somewhere else and be causing other problems. So firstly, when do we tend to use antibiotics? So there's evidence that actually if your child has a discharging ear, if there's actually pus coming out of the ear, then probably the balance shifts in favour of antibiotics, and they are likely to make the illness recover a bit more quickly and less likely to have longer term problems. Then there's the situation where your child maybe is just not improving. So as Sally said, most children with an earache, middle ear infection, by about day 3, if not before, they'll be significantly better than they were at the start. They may still have some symptoms, but you're confident that they're recovering. If you're going to day 4 or 5 and they're still significantly troubled by their ear, even if the ear isn't discharging, it may well be time to try some antibiotics. So you might want to run things past the doctor or nurse then. So that's another time when antibiotics can be helpful. In particularly young children, so babies under the age of 6 months, where again, we're a bit more likely to prescribe antibiotics. So if you're pretty confident it's an ear infection, I appreciate it can be hard to tell that. Again, that might be a reason to talk with a doctor. But essentially, if you've got a child under 6 months that's looking a bit hot and uncomfortable and irritable and not sleeping well, and there's nothing else obvious to point to, and maybe they're slightly rubbing one ear, that might be an indication that they've got an ear problem, and seeing a doctor or nurse would be helpful because some antibiotics might help settle things down for them. So then the final things to think about are actually the really rather rare but potentially quite serious complications of an ear infection where it spreads somewhere else. So it can spread locally into the bone behind the ear. So if you get any really obvious swelling behind the ear, pushing the ear forwards, that's a potentially concerning sign, need to see a doctor or a nurse. Or if you find that just that bony bit behind the ear is a bit red and very tender, that could also indicate the infection spread beyond the middle ear itself. Very rarely, unfortunately, ear infections can go deeper into the brain and cause problems there, and they usually present as really quite sick children, unsurprisingly. So they might have a really, really severe headache that's just not getting any better as time goes by, that's not responding to paracetamol or ibuprofen. They might have other sides of an infection deeper in the brain. So we know about having a very stiff neck as being a feature of meningitis, or that they really cannot stand having bright lights shined in their eyes. So a child with severe headache, notwithstanding bright lights and stiff neck, certainly needs to be checked out. Okay, I think those are the main things to think about in terms of the serious things to think about. There might be other reasons you want to check things over with a healthcare professional. So if your child is just a child that's actually got significant long-term health problems, then obviously they're a bit more vulnerable. So certainly any child with immune deficiency problems, children with Down syndrome are a bit more prone to having problems with ear infections. So these are all good reasons for discussing things with a healthcare professional. Okay, so final sort of features might be if the child is getting dizzy, and particularly if they've got any unbalance or coordination problems, that's concerning, and that could suggest the infection is progressing in a more concerning way. But just to emphasize, those complications are really pretty rare. We don't want to miss them because it's important we pick them up, but they are very rare, unlikely. And sadly, as Sally's already indicated, prescribing antibiotics just to prevent these things happening is not really very helpful. It probably won't make any difference, and we should really think about antibiotics when we know they're going to help your child.